Are you wondering, would my loved one qualify for hospice? James, if we go after hospice, if that's a decision we make as a family together, would my loved one actually qualify for the 100% covered benefit for all of the services that hospice provides? Well, today I'm going to break down the hospice eligibility for you in simple terms so that you know personally what the doctor's looking for, what a hospice organization is looking for, and so that you just know and can tell if it's worth making that call. Okay, it's a big decision, and as I speak with many families, and they've actually reached out, they're like, James, I don't even know if it's time. We love the idea of all the free services, everything that hospice can benefit for my family, for my loved one, the care that's provided, but we're just not sure. And I always encourage those individuals, especially daughters, like, hey, I am just glad that you are reaching out, that you are the caregiver and the loved one that says, you know what, there are services out there that will bless my mom, will bless my dad. And you're searching it out, you're seeking it out, you're trying to, have the courage, bring those things, those resources. And so I just want to, first of all, encourage you and just say, great job. And let's dive in. Again, you're going to leave today fully understanding of what qualifies for hospice. And we're going to do this in 10 minutes. All right. So big picture, in most cases to qualify for hospice, doctors are looking at these three basics: a serious life-limiting illness. Okay, so something that is a serious life-limiting illness. That could be cancer. That could be a heart-related disease. It could be a lung-related disease. It could be, there's many different diagnoses, but they're really looking to stay 10,000-foot view, and we'll dive into further videos on more specifics, but a serious life-limiting illness. An estimate that if the illness runs its usual course, so this life-limiting illness, if it runs its usual course, life expectancy may be around 6 months or less. Okay, that is the hospice benefit is supposed to, if the illness takes its normal course, that your loved one may be finishing that race in the next 6 months, may not be with us in the next 6 months. Now, oftentimes we'll see that the disease process doesn't run its normal course, and it could be over 6 months, okay? I definitely want to leave you with that piece, but at least it has to be able to show and track to the doctor that this individual may not be here in 6 months. And a shift, number three, a shift in focus from curing the illness to comfort and quality. That's important. And they really want to know, hospice, we want to know, the doctor wants to know, the medical director is this family, are they at the place where we're not focused as much on the cure, okay? We're more focused on quality of life, comfort, time spent, staying out of the hospital, staying away from all the different things that may at one point may have been beneficial, but now we're saying, you know what, we want to be more comfortable. We know that season and that time is coming, and we just want to make the most of the time that we have. We see this again a lot around Christmas time as well. It's December here, and as we look at Christmas, so often no one wants to spend multiple times and multiple trips to the hospital around Christmas. We'd rather be with family. We'd rather be with our loved ones, and we would prefer to have that comfort and quality of life. So that's important to understand. Those three things: a serious life-limiting illness, an estimate that if the illness runs its usual course, life expectancy may be around 6 months, and the shift in focus from curing to comfort and quality. Okay? What doctors look at? Doctors don't have a crystal ball, but they look at patterns. So again, what they're looking at is they're diagnosing. So we're looking at a diagnosis of cancer, heart disease, dementia, lung disease, etc. They're looking for a actual diagnosis. They're looking for decline over time. So more weakness, more help needed, those types of things. So with that diagnosis, you're also seeing that your loved one is just slowing down. They need more help. There's more weakness, and they're adjusting on that. More hospitalizations. So hospitalizations, going to the hospital. My goodness, we're going a lot. There isn't a whole lot of results, but we're going out. They're checking that. They're also looking at weight loss or loss of appetite. Those things, again, show those potential declines. The body's just slowing down. It doesn't need the nutrition that it once needed, and weight loss is naturally going to occur. And then change in mental status. Potentially, your loved one may have more seasons of confusion, maybe sleeping a little bit more, And, it's just, again, these are all natural signs of the body is slowing down and saying, you know what, I just want to take it easy. And I don't need to go out and fight this more. Maybe we've fought the good fight. My grandmother, she fought cancer until the very end. She was a fighter. But then there also came a time where it was like, you know what? I just want to spend time with my family. And I don't want to keep going to the hospital. And so, and then you also, again, she did sleep more towards the end as time went on. So the key is this illness clearly is advancing and we're shifting towards comfort as the main goal. So doctors want to hear that, want to see that. You as a family are recognizing that is important to you. And that's what we're looking at. Number 2, age, diagnosis, and too young. Common myths about eligibility. Okay, so here's some of the myths. Myth number 1, hospice is only for cancer. I can't tell you how many people think that. Like, no, my mom doesn't need hospice. She doesn't have cancer. Reality is that it's for many illnesses. Again, heart failure, COPD, which is and dementia, kidney disease, all of those types of things. Hospice covers a wide range of things, and those things can help qualify somebody. So again, most of these things are things that are going to take all of us out at end of life. All right, just total honesty, the body's shutting down. Again, I believe that we're spiritual beings and our body can only go so long. And then it's time to go to that next stage. And for me being a Christian, I have full faith on where I'm going and what the plan is. But my body's not meant to live forever. So heart failure, COPD, dementia, kidney disease, these are all things that take people out. All right, it's just our body's failing. And so hospice is for you, for your loved one in that season. Another myth, hospice is only for very old people. Reality, eligibility is based on illness and prognosis, not age. People in their 40s, 50s, and 60s may qualify if the illness is advanced. Heaven forbid, Lord willing, your loved one's not in their 40s, 50s, and 60s. We want to see a good long life, but we also understand that the Lord has plans and we're not in control of that. And we need to make the best. And especially as a caregiver, you may be the one in this season who's having to make these tough calls for a younger patient. And so hospice may be appropriate for them, but it's not just for elderly. Now, again, if your loved one is elderly, in those 70s, 80s, 90s, definitely, they can qualify for hospice as well, but we're really based off of those things we talked about earlier, those signs and things that doctors are looking for. And so we're really looking at the illness and prognosis, not the age. All right. The question isn't, are they old enough? It's, is their illness at a point where comfort focus makes the most sense? Is their illness at the point where comfort focus makes the most sense? All right, so we're looking at that. Number 3, how to find out without pressure. So the easiest way to know if your loved one may need hospice is just to ask. And just ask. These are wonderful services, wonderful gifts. I stress on it again. There are professionals out there who are here to make the journey easier for you and for your loved one. This is an amazing benefit. It's 100% covered, and if they qualify. And so just ask. Talk with your doctor. You know what, doc, do you think hospice might be appropriate now? Mom's slowing down. We're seeing these things. She wants quality time with us. She doesn't want to keep going to the hospital and getting IVs. We're scared. We need help. They're struggling to get her in the shower, all these things. And hospice can come in and benefit and bless in those moments. So ask the doctor, do you think hospice may be appropriate at this time? Another option would be call a hospice agency. So like directly, no obligation eligibility assessment. So all hospice agencies, you can call them directly. Just Google search hospice organizations in your area and you can give them a call and say, hey, I'm curious if my mom, if my dad may qualify for hospice. They're going to get you in touch with somebody who can help do that pre-screening, talk with you a little bit about some of the diagnoses, the things you've been seeing, and determine whether a nurse evaluation to come out and see your loved one would be appropriate. They can come and do that right in your home. Again, you can also reach out to me as well. Right on this page here, you can shoot a comment, reach out. We're going to have more channels for you to be able to do that in the description. But again, I just encourage you, I can definitely help you with that as well. Again, I work in hospice day in and day out. As you can see, I'm in my car now and meeting with patients and families day in and day out, working with our nurses. So I've got you too. Just drop me a comment and happy to help you through this process. So again, you're not signing anything by asking. You're simply getting clarity. All right. There's a lot of projects and things we do in life where we just need to get some understanding. We're not buying, we're not signing on the dotted line today. All right. We're just getting clarity so that you understand and you know the process. Really important. So, and then to recap, all right, we're going to close this video out today. Again, I appreciate you being with me. If this has been a benefit to you, I encourage you to, drop comments of things that you would like to learn, hear about, understand more. I'm happy to help with that and share more great topics. This channel, Hospice Peace University, is not going away. We are here to serve you. Again, I've worked in senior care for over 16 years, and I'm here for you. So drop a comment, share this. Also encourage you, if you're walking through this season, definitely subscribe to this channel. There's a stat out there that 75% of people who watch these videos or any videos on YouTube, they're not subscribed to that channel. So I encourage you, hit that subscribe button. I would love for you to support our channel and continue to get the content and the knowledge and the ability and the training that you need. We're here to support you. So in closing, to recap, eligibility is about serious illness, a 6-month window, and comfort focus. It's not just for cancer. Okay, and it's also not just for the very old. All right. The best way to know is to ask. Ask your doctor, ask Hospice directly, drop me a comment, drop me a message. I read all my comments. I'm here to support you. And if this has helped, again, also you can just drop the comment eligible in the chat. And again, happy to send you more information and help you out. So with that being said, I appreciate you being here today, and I would like to wrap this video in prayer. Father in heaven, you know the individuals who are here and are a part of this channel and the person watching this, Lord, I pray that you would give them strength. One does not simply search for hospice on Google or YouTube unless maybe they have a loved one that they're caring for and need it. Lord, I pray that you'd bless them, fill them with strength. Thank you for this time today. And we pray that you would bless those watching this video and give them strength, give them hope, and God bless them. Amen. All right, guys, have a great day. We'll talk soon.